Next, we have Dr. Linda Anegawa. She's a primary care physician, double board certified in internal medicine and obesity medicine. She has over 20 years of clinical experience. Thank you for being here.
Thank you, Dr. Cavalli. I've been a primary care teaching physician. I've always believed in a team-based model of care. Medical students, residents, as well as nurse practitioners are an important part of the team. I've trained and supervised many. Now, supervised, though, is not a rubber stamp. Physician oversight means I have reviewed the history and physical exam findings. I've corrected errors. I've given ongoing feedback to nurse practitioners to make sure that the patient is cared for in an appropriate and in a safe way. Now, this is what I've learned in 20 years. Nurse practitioners can't provide unsupervised care. Serious errors can result when they don't know what they don't know. And I've actually experienced this both as a teaching physician as well as a patient. Some years ago, I underwent a muscle injection procedure in my neck by a nurse practitioner for pain relief. And this was a nurse practitioner that I taught, like many others, so I felt confident. Immediately after this procedure, I was hit with severe difficulty breathing. I couldn't walk across the room. The nurse practitioner's assessment, I was fine and probably having a little bit of what she called procedure anxiety. And that was when I realized, despite my teaching her, she really had no understanding of the complex underlying anatomy and physiology of what was happening. Because I knew, because I was a physician, I got myself to the emergency room. And I was immediately diagnosed with a punctured, collapsed lung by the attending physician there. Without treatment, I could have died. But because of my education, I recognized the warning signs and got the care I needed. What would have happened to a patient who didn't have my medical expertise? So here's my takeaways. Should nurse practitioners be a part of our team-based healthcare? Yes. Are they equivalent to a physician? No. Can nurse practitioners be trained to perform independently and safely like a physician? No, not unless they go to medical school. You know, we talk about care shortages, especially in the time of COVID-19, and closing the provider gap. But this does not close the physician gap. There are no shortcuts in taking care of the lives of human beings. Thank you.